I don't guess it recorded any of that stuff. Anyway, let's get this back up here. I don't know what happened that it stopped recording. Your Nursing Diagnosis Handbook. Short and brief. How do you use your Nursing Diagnosis Handbook, and why would you even have to use it? When you start doing your clinical reasoning tool, you will need this book. It has a lot of information in it on examples of how to do a nursing outcome, which is NOC, or nursing intervention, which is NIG. You have short-term goals and long-term goals that you will have to write. Interventions you will have to write for your clinical reasoning tool. And you will be doing a clinical reasoning tool for part of your test on this critical thinking, clinical reasoning as lecture that you're fixing to have, or that you're in the process of doing right now. You'll see that you have some green pages. These are if you know what's wrong with your patient. You can look it up here. Like if you had an abruption, if you had carpal tunnel, this one's got even catheterization, urinary. You can look it up here, and down underneath it, it will have some diagnosis that may fit your patient. It has to fit your patient because you have to be sure that you justify that it fits your patient. And then once you figure out that, say you want to do anxiety, you picked out something that had anxiety, and you go over here and you go to the A's. And in the A part, you will find anxiety. Then you'll find an anxiety related to. So you will have to be able to relate it to. So it has a lot of information that you'll need to take this book with you to your clinical rotations, especially in med-surg and OB. Anytime you have to write a clinical reasoning tool. There will be some we do case studies because you won't have patient that long. And that's all there is to the nursing diagnostic book.